have a resource fair for our families, our patients, to ensure that they knew what resources were available to them. We're also doing our SoonerCare outreach to try to enroll eligible children into the SoonerCare program. Overall, it's just a great event for kids to come to. We're going to have fun activities, and families can learn more about what resources are available to them in the community. Under our CHIPRA grant, we've done all kinds of different outreach. We've done outreach with our patients, we've done outreach at different community events and at different Native events. We found that there are not a lot of events in the winter time, so we decided to make our own event to ensure that we could continue our outreach through times where there aren't other events going on. At our event this evening, we're going to have multiple resources available for our families. So we're going to have Community Action Project, we're going to have the Girl Scouts here, we're going to have different parts of our clinic represented. So our hope is that when the families come and go through all of the resource booths that we have, that they're able to take at least one resource home with them that will make their lives easier or better.
Tonight's event that we're having here tonight always helps to promote our camps because we're able to put information out there to new people. It seems like every time Indian Healthcare has a different event go on, there's new people showing up each and every time. And when we're able to get a flyer out to one person, you see that it filters into a few more people's hands, friends of the families and other people that it would benefit. I think that having insurance, private insurance, and SoonerCare helps parents allow their children to be more involved in our camps and other sporting activities, because they know now if there's a chance that they can get hurt, that insurance is going to take care of it. Whereas if kids didn't have insurance, parents wouldn't allow them to participate in our camps. So the expansion of SoonerCare and getting these kids insured through the past 3-4 years has really expanded our program with kids more opportunities.
Signing up for SoonerCare was very easy. I came here and they had asked me if I had SoonerCare, and since I didn't have it, they sat down and they went over it all with me and they got me SoonerCare the same day. So I was able to leave here and set up a doctor's appointment and take my children over there.
I like this hospital because the doctors are really nice.
This whole powwow started with Systems of Care. With Oklahoma City has the National Children's Mental Health Awareness Day, and we're participating in it. This year's theme is Courage to Change, so we're kind of taking the anti-bullying theme this year, and we're hoping to have a lot of booths there set up, vendors, typical vendors with Native American jewelry, and then also informational booths as far as any kind of mental health awareness or Big Brothers Big Sisters, and anybody like that can help come and participate. There's no booth fee for informational booths.
Our patients at Indian Healthcare do love coming to the clinic to have applications processed. It's much easier, it's handy. They're coming in for other purposes and they can take care of it here. Our application for SoonerCare takes very little time. Average maybe 5 to 7 minutes to do an application if they've never had it done before. Maybe a little quicker if we're recertifying and they're already in the system.
I think the fair will be beneficial because we're going to have so many activities for the kids. They're going to get to see the clinic, they're going to get to see how we do things, what we do here, how we help out people, and they're also going to be able to have a little bit of fun at the same time, with which kids and fun, and then also snacks and programs and events. I mean, those are huge for kids, so it's going to be a lot of fun, and I think it's going to benefit them, and they're going to want to come back, especially when they see the friendly faces and the environment and the excitement from everybody else that are excited for them to be here. So I think it'll be a huge benefit. I think that CHIPRA has done a whole lot for Indian Healthcare on its own. Holding the events that CHIPRA holds and handing out the things that CHIPRA hands out, and the fun little gifts for the kids, and the exciting information for kids about how they are going to get to go to the doctor and see the doctor, and how the doctors are excited when they get here. It's helped out a whole lot. The events really bring people here, and they show people that just because you're in a certain bracket in life doesn't mean that you have to be left out. It shows them that they can be just the same as everybody else, and they can go see a doctor just like everybody else and get the equal opportunity as everybody else. So I think Chipper actually is a huge motivator for Medicaid and for children in SoonerCare and the whole everything. It's huge. It helps out a whole lot.